already. But what we're here for is to understand how we can all improve our offerings to the patients and the carers, which are central to our being. And so we all have a community that we serve, which is centred on the patients and carers, but extends to the healthcare professionals and through the advocacy to policymakers, to government and the health service management teams, and also to pharma and to the academic community, which we mustn't forget, that we're all trying to improve the way that diagnostics and cures can be improved, and so we need to relate to that early stage research as well as to the provision of care and information. And I think we all share the same goals, which is to raise awareness, both amongst the potential patient population and amongst the general population, as well as amongst general practitioners and other clinicians. And we need to be able to provide trusted information to those who need it, and ensure that, as Lorenzo was saying, that disinformation and misinformation is caught and corrected as soon as possible. And we need to advocate with policymakers to ensure that the services that are provided everywhere that they're needed, in the strength that they're needed, so that we can get rid of this inequality across the nations, which we all see. And the thing that I think we didn't mention too much this morning, although I think Umberto referred to it, and I think you referred to it, Elizabeth, as well, is in order to do all of these things, we need to be raising funds. We need to be raising money. So we need to have good ways of raising money. So I think that in achieving each of those aims, I think from what we've seen this morning, we each of our groups have got strengths and deficiencies in each of those areas. So for the next hour or so, we can discuss how we can benefit each other, and how we can work together to improve what across Europe we can offer to the patient community. So what I wanted to do first is to put you all on the spot, if there's an Italian saying for that, and to ask you in turn, of the things that you've heard this morning and of what you understand of your organisation, what strength, what capability do you think you can best share with the other groups to increase our offering across all of our countries? And since you're sitting on my left, Liliana, I'm going to ask you first. What do you think you do very well that the other groups could copy or duplicate in order to improve what they do?
As Espoir is the youngest association, I think we are more copying everybody right now than like. Yeah, I think it's more us being inspired by what others are doing. So we try to use all the resources and ways to do that everybody built for the past years. But I think one very good point of the French association is the very strong connection with a network of physicians and clinicians, and so we have a clear landscape on what has to be done, and we can directly. It might be easier for us to engage things with a network of clinicians everywhere in France, and I think that's a very good thing that we have. If we find something that lacks somewhere, maybe we can benefit from that to leverage it like on an efficient and fast way. Out of that, I think we have still so many things to learn in the way we are directly involving the patients in the organization. Like we haven't really created a network of patients, for example, and I really like what the other associations are doing in terms of having virtual meetings, having WhatsApp groups. This is going to be really important and key for us on the next steps, for sure. And it's going to help us build a network of patients everywhere in France.
So when you were asking the question, it came up three words. Okay, so the two first words are connected, would be collaboration and networking. And this goes because we are collaborating national with other GI organizations and also umbrella groups, and also international because we are following and observing AMMF and CCF, EPIC, that they've been for a long time on the field, and actually that was the third word, observing what you are doing and to learn from all your journey. So also another point that it's really important about the networking, it's not only networking with oncologists and other healthcare professionals and as well researchers, also with the pharma industry, that here is something that I think we should work together as well on the best practices on how to partner with pharma industry. And I think as you have been for a long time there, we could get some mentoring on that, like, because sometimes they can take advantage as well. So best practices to do. I think that sometimes every quarter we could gather all together on a Teams call or Zoom call and put thoughts together. And also about networking is about with patients and caregivers. So what we try to look is always when someone is eager to collaborate with Atuvivi and they want to collaborate like volunteering. So we see what they want to do and how much they can fit and how many time they can invest, because what we don't want is like person on and off all time, since it's difficult. It's a volunteer job, of course, you cannot ask full commitment, but at least to have, if they only can be for a month, so at least ask for that month to be committed, not suddenly disappear, that sometimes we have had this thing. And that is one of the things that we are dealing now to see how to professionalize the association. And also this, I think that we can learn a lot of you. So again, observing.
The research point you suggested us is difficult because you need to get a lot of money to run it. And I'm not really able to collect money, but I think we have to try to improve it. And as even Umberto Cillo suggested during the lunch, one point is to use the social media for that. At least as APIC, we had some success when the Corriere della Sera interviewed us or published a podcast or something with one of us. Recently, this happened with Mirella, who is one of the founders of the APIC, and then we have people looking for us, writing us. That's different from collecting money. And just looking at what other groups who collect money do. The point is that you have basically to bomb people to get money. And I don't think that, basically to ask companies, drug companies, pharmacies, to help us when we run meetings. This seems to me proper. If we asked more money to invest in research, that would be a little difficult on one side. And, they will see us as collaborating with capitalism and blah, blah, and that could be negative on the other side. So I am completely unable to do it, but I think that the point is to find a way to bomb people, to write to the people who wrote us, to make ads around that there is this huge illness which is terrible when you get the diagnosis, and that something can be done, also because we are at a moment in the history of cholangiocarcinoma where things are going a little better than 10 years ago. 10 years ago it was hopeless, almost completely hopeless. Today it is not completely hopeless. People write me, Paolo, what is it to live 7-10 months more with a new drug? Look, first it's 10 months more, and I don't despise that too much. But then what happens in that 10 months? Other drugs come in. Now they're starting to put succession of drugs. So you can hope to live 2 years, 3 years, if things go. And we have to tell that this is the point, that we want money to be helped to be able to help people who stumble on cholangiocarcinoma, which is terrible for who gets the diagnosis and for the caregivers too.
I think that is possibly something that we could share is if any of us find things that work really well in terms of fundraising, then we can share tips on what seems to work. Although I don't know, that might be a national thing, and what works in Britain might not work in Italy. I don't know.
You can bring to all of us today, and I've got sort of some very simple top-line things I want to share with all of you. I mean, your organisations are very young, are very new. So I would say, when I look back over the years, I would share with you, believe in what you're doing, right? Know that what you're doing is something really good, it's really needed, never lose sight of that. Carry on with the determination and the passion that you feel today. So that would be my message to you, is just keep hold of that determination and passion, because what you're doing is truly important. And one day you will look back and think, look what I've achieved. So don't ever lose sight of that. I'd also like to put forward just a simple suggestion, and I know we're going to come on to that later, but what I would like to suggest is that perhaps when we leave here today, we think about the four of us, the groups in Europe, and I know UK is not strictly speaking in Europe, but we feel quite European.
You are European. Whatever you think.
Indeed, we are. And that maybe we set up a webinar, and we have at least twice a year, we join together as we are now, and we share what's good, what's bad, how can we help each other, what's missing, what has any one of us done that's worked incredibly well. We're trying to reach the general practitioners. Have we had success with that? How have we achieved better success or not? And then we can share our ideas. And I think we shouldn't let today go. This should be the beginning.
Vorrei solo intanto ringraziare la dottoressa Rimassa e il professor Cillo che ci accompagnano da tempo nelle nostre iniziative, e vorrei proprio condividere un punto che è fondamentale in questi incontri, condividere delle esperienze, condividere delle cose, perché anche noi siamo nati come volontari, non avevamo nessuno competenze specifiche di che cosa voleva dire fondare un'associazione di pazienti o altro. L'abbiamo imparato conoscendoci e di volta in volta. E colgo il suo spunto, guardare cosa abbiamo fatto fino ad oggi. Fino ad oggi noi abbiamo iniziato in cose molto semplici, organizzare raccolte fondi a Natale e a Pasqua. Offriamo in cambio di un contributo panettoni e uova di Pasqua, che ogni socio si fa promotore e porta a casa dei conoscenti, dei propri conoscenti, ed è un modo per raccogliere fondi. Qualche migliaio di euro quindi 2 volte all'anno riusciamo a farlo. Abbiamo anche noi, come gli altri, quindi oggi anche imparare che abbiamo fatto cose che anche gli altri hanno fatto vuol dire che eravamo tutti nella stessa direzione, che sono appunto fare una chat dove i pazienti condividono e da lì noi impariamo anche, prendiamo conoscenza di quelle che sono le loro esigenze al momento, che in questo momento sono molto concentrate sull'aspetto psicologico e nutrizionista. In questa chat chiaramente, ma anche sul sito web, chiedono informazioni primarie, parte tutto dalla richiesta di informazioni mediche. I centri specializzati che il professore faceva riferimento era uno dei nostri primi obiettivi, cioè fare 3-4 centri specializzati in Italia dove gli altri ospedali più piccoli con meno interventi potessero mandare le persone. Purtroppo questo ancora non succede perché il chirurgo che trova il paziente ha, come dire, orgoglio, piacere, soddisfazione di risolvere lui la questione, purtroppo spesso non avendo le competenze, e questo, come diceva il professore, è un grosso danno. Anche noi facciamo webinar, ultimamente abbiamo fatto webinar di assistenza psicologica poco frequentati sul momento, ma poi molto visualizzati, vero Paolo? Dove la gente trova risposta alle loro difficoltà nell'affrontare la malattia, perché comunque nessuno di noi è preparato, né come paziente né come caregiver. Quindi vi faccio un esempio che mi ha riempito il cuore proprio pochi giorni fa. Una psicologa che ha fatto un webinar con noi ha sentito l'esigenza, leggendo la chat, di una persona che era in difficoltà a dormire e in un attimo ha prodotto un audio con delle musiche e delle parole per aiutare ad addormentarli. Credo sia... Quindi mi viene da dire che ognuno di noi, quando si presta a fare qualcosa per gli altri, poi trova vie sconosciute, ma che possono essere nella loro semplicità di tanto aiuto. Siamo riusciti a entrare nel terzo settore e anche quello adesso ancora non ci ha dato grossi, però anche la raccolta fondi è una cosa molto complessa, perché noi per esempio come associazione siamo piccolini. Cosa succede? A parte queste raccolte che noi facciamo, principalmente purtroppo riceviamo dai fondi dalle famiglie di chi non ce la fa, che per qualche motivo raccoglie fondi. Quindi anche questo non è una cosa che noi possiamo, come dire, preventivare, perché è anche bellissima la proposta del professore, no? Assistere i pazienti che devono spostarsi. Noi l'abbiamo anche pensata in passato, è impossibile perché sono spese che non puoi prevedere, non sai la quantità e non abbiamo un'entrata che ci possa permettere di fare questo tipo di progetti. Oggi, come gli altri convegni, a me personalmente, ma penso a tutti, ha aperto a una speranza, la possibilità di ritrovarci. Bellissima questa proposta di fare 2 webinar all'anno dove confrontarci, proprio perché sono spunti di informazione e di movimento, cioè di che cosa possiamo fare da oggi in poi di meglio, perché comunque, come dire, nasciamo tutti da una inesperienza. Grazie a tutti davvero.
Frederica, do you want to add anything from your experience? Is there anything that you think you would like to see the 4 groups represented here do better than they are doing at the moment?
Penso che stanno già facendo molto e molto bene. Sicuramente tanti complimenti per i giovani. Vedere comunque questa continuità, che non sono solo i grandi in età, diciamo così, matura a voler pensare alle generazioni future. Questa cosa gratifica e fa piacere. L'unica cosa che posso dire è che di continuare sempre ad essere mossi dal cuore della passione, e questo dà la forza anche quando ci sono le difficoltà o comunque le situazioni sembrano irrisolvibili. È sempre quello che ti aiuta a guardare sempre quello spiraglio di luce che c'è sempre.
And Lorenza, in your presentation, you summarised very well the things that the associations, the groups should be doing. Is there anything in your experience of each of the groups? Is there anything which you can suggest needs a bit more attention than other bits?
So first, I have to say that the most important thing I have heard today is that the 4 associations have different backgrounds, of course, different stories, but the themes are more or less the same, and this is really, really important. In terms of things to do, I don't know if there is the one that is the most important. I think in the different countries, on different areas, maybe there are some aspects that should be more promoted in some way, or that need more efforts. But overall, supporting the patients and working together, the different associations in different countries, and working together with the physicians in each country. I think this is really, really important. And the collaboration, as mentioned by Helen, the collaboration among the 4 associations in Europe, and I consider the UK Europe, I think this is something that will be very important, and I think that will be even more effective in helping patients across different countries. So I think this is one of the most important things, and then try to help patients according to the needs that are the most important. For instance, now in Italy, having access to drugs, having access to testing is one of the most important things. Maybe in the future it will be no longer, hopefully. And so I think the collaboration to me is key, and I think this is the most important thing to me.
Thank you. No, I have not so much to add to what you already said. I think, so from the perspective of a caregiver, I'm the son of Francesco, and I'm here with Federica. I've never been super involved in the APIC Association. I always, let's say, followed Francesco, that was really, really involved. But we, with Federica, we were a team, and also with my brother Michael. So I think the APIC was game-changing for us, because before knowing APIC, we were lost. We're like, we don't know what to do. You are not prepared. You don't know anything about that. You can read online, but yeah, it's true, it's not true. Then you trust the hospitals that you go to, because it's like something innate, maybe, no? When you always go to the hospitals, you listen to the doctors, you think that every doctor can help you. This is something innate that everybody kind of thinks. Then, of course, you understand that is not true. But while you understand it, it's too late. You don't have time. So for us, for example, to share something that worked from our perspective, was the first meeting that we attended to in Bologna. Was like eye-opening. We were we arrived. We listened to all the professors, to Paolo, to everybody there, and we really learned that this was something different. That you had to have like different tools, that just like specific tools for that, and you have to learn that by someone who already went through that. And also all the content before, let's say the content online that we found, that Francesco found, because he was always the one looking for everything. He found some content online published by APIC. For example, there was also an interview by the Professoressa Rimassa. It was one of the first content that we saw. It was like very specific. This is what we were listening to other doctors, to other things, but we're not sure that this is the right thing. And then you listen to that and okay, this is the thing. That's when we understood we need to go to this meeting, we need to learn from doctors, we need to understand what's going on. And this saved our father for 4 years. It's the difference between 0 years to 4 years, which is a lot. Because in the meantime, as Federica said, he did everything. He continued his, let's say, career as an athlete. He did races, he did a triathlon, he ran with my brother. It was incredible. We did several trips together, so it doesn't have it's worth, like it's difficult to explain. So it changes from 0 to everything. So I think this is what really worked well. Then of course we know it's really, really hard, this job. So congratulations to all of you. Really, it's really inspiring what you're doing from a lot of years, Helen, Paolo, and you guys, really young people pushing on this. It's inspiring. So thank you.
And some of the things that you discussed earlier, I mean, you Paolo have written your 40 papers over the last 3 years. AMMF have got a number of documents. You've produced some. You've got your 10 steps and your questions to ask your GP. Is there anything that we can do to not exactly standardise, but to benefit from each other's sets of publications, so that our patient communities have got access to the best set of questions that they can ask, and to the best steps that they need to go through? I mean, I say that appreciating that we are all small organisations and we're all stretched doing what we do already. So adding more work in the short term might be a benefit in the long term, but I don't know. Does anybody think that potentially could be?
So first of all, I would like to point what Helen mentioned before about the meetings. So basically, we could take the opportunity to VTC network in Rhodes, to get some time together and to have like one of our meetings there in person, if you think that it's good. Well, it's one of the key actions that we can take in the short term. And then I was thinking, and we do have, and of course this is needed, the ESMO guidelines for how, like, the treatments that needs to be followed. But I was like, this is only brainstorming. I think that we need to put this idea, if you like it, in context, but some guidelines in the European sense for patients, So the standard care for patient in BTC, and it would be a way that then we could as well to present to our country, because each country works completely different. Each country has their own barriers that each of us, we know what we have to work with. But first of all, to look like broadly how we can work as a guideline. It's like just came up now. It's something really, really brainstorming. So I think that it needs a lot of mature on that and work. But you've been working already, IMMF, with all the website. So how we could like cope more together to impact more Europe. And also, as also with the Cholangiocarcinoma Awareness Day, that is already the Global Alliance, that is already working, but it's more worldwide. So, but also some work Europe specific, because Europe is like US. So, I mean on size, right? So I think that on here we have to work all together and see how we can move forward. Just ideas, I don't know, like.
Thank you. I think meeting face to face when we can would be great. I'm very happy to do that. I think one of the issues that we have is we're all working. We all have the same aim. We all have the same objective, that we want to help the cholangiocarcinoma patient. We want to find ways to earlier diagnosis. We want to find faster ways onto that treatment pathway, far more people getting surgery that need earlier diagnosis, better, more effective treatments, and it's coming, but it's so slow because it's all around clinical trials and research and so on. So they're our sort of overarching aims, but we all have individual problems within our own countries. So we can say we want this, we want this, we want this, and you go to your healthcare authorities and they say, no, you can't do that. You can't have that. This isn't the way we work. And that's the big difficulty that we have. We're actually doing a project at the moment which is called Patient Pathway, but really it will be quite UK specific. So we're going to the patient to say, what happened to you at this point, at this point, at this point? We'll see what really happens, and then we'll look at the guidelines at what the optimal that should happen, and then we see where the gaps are. So that's a big piece of work that we're doing. And when we've come to the end of that, we're very happy to share it with everybody. We're always happy to share all of our work with everybody. Anything that we've done, just let us know, you can have it, so that you can maybe adapt it for your own countries. But I do agree that we have the World Cholangiocarcinoma Day and the Global Cholangiocarcinoma Alliance, both of which are AMMF-initiated ventures many years ago, which we very altruistically said, we want to help the world. Small plan, but actually, it's very difficult because, as you rightly say, the US is massive. They have their own issues with their insurances and so on. Those of us who are working under national health care systems, we have so many other problems to deal with. We've got massive problems with cholangiocarcinoma in Southeast Asia. In fact, all the countries bordering the Mekong River, because they have the liver fluke-induced cholangio. It's not one size fits all. We know that. We're working with the same disease. We're working with the same objectives to help the patient, but we all have to get there with slightly different pathways. So I think Southeast Asia is probably a group that can work together. America is, 50, how many states in America? 50 countries, because they've all got their different rules and organizations. And Europe, we should be working more together, but there will be limitations. But I think if the four of us can really get together, and this is a beginning, as I say, that could be so helpful for the future.
But I think that if we raise awareness, because it's important that other associations, they kick off in other countries around Europe, because they would support a lot of patients and caregivers. So also only to help to give a guidance how to, all the documents that you have, right, Helen, up to there. So just to have in some drive or somewhere that when someone has the idea to start the association, they could translate to their own language, or you already have translated most of them. So, that would help a lot, because normally you don't know how to set up an association. And when my mom got the disease, I wanted to start an association, but I didn't know how to start. And I was not brave enough. So basically sharing these inspiring stories like yours, I think that we would help to get more associations across Europe. Absolutely. That it's what we need, and we would be stronger. So it's one of the things that, and we will help a lot of people. So it would be nice, but to have a guidance, like somehow, like some guidance, because otherwise there are a lot AI, as we already mentioned. It's not information trusted always. So it's better if it comes from our side than if it comes.
But I think from what we've heard of the 4 groups, each of the 4 groups has actually originated in a slightly different way. So although the basic thing is you need somebody who's prepared to actually make the sacrifice to do it, the way that you go about creating the group is different in France to Spain to Italy. So we would need to have a sort of joint paper which says these are the inspirational stories, and these are the common parts of our origin stories, and these are the bits that were different. So there's more than one way to do it, and there might be other ways that we haven't thought of. But the key thing is you need somebody who is actually prepared to stand up and make the move.
We have different stories, but we have the same illness on which we work all separately, so to speak. I think that we have to find some initiative which is common initiative. Our stories are different, and we cannot change that, But we can see some future together, not some past, some future. And I think that it would be interesting to find some way to have so to speak, a continental impact, not just an Italian, British, or Spanish, or French one. For that, I think we need even to find a symbol, because to find a symbol to be recognizable is really relevant. And I think that we could find a symbol, describe, in a simple way, how terrible this illness is, and to look for help, just bombing people, that look, we need to do research to improve. Also because we are at a moment of time where we have a little more hopes than we used to have, and this is something to work on. If you give us some money, we can have better prospects, and we are in the way of having better prospects. It's a hope with some reasons for being hopeful. Then I think that we could even, at least in some cases, I had one idea for us, Italian, but I think would be nice in a larger environment to, for instance, fund a research on nutrition. All what I've seen about nutrition basically is, let me say, generic. Yes. Generic for tumors, okay? It seems to me that we need something specific for this kind of tumor, which anyway is involved in digestion because it passes through things which are relevant for digestion. And since nutrition is so popular as a topic, almost any day I open a newspaper or I listen to the radio. I don't have television, so I don't know what happens on television. No? There is someone telling something about nutrition. So it's something which is, maybe the Italians are crazy. They claim that we have the best nutrition possible. False. We had a good nutrition. Nowadays, industrial production is just terrible, even in this country. So to have a common initiative on research, and at the same time to find a way, I say even finding some guy clever at ads, some professional, to find a way to be known. To explain, I use this metaphor, which I think, at least it impresses me. I hope it impresses even the others. You know, in Italy, basically each single year, a town, small but not just insignificant, disappears because of illness. So, to try to reduce this disaster is relevant, and it is so relevant because this is something you are not anxious at. You know, people know that there is, you know, pancreas, for instance, and other cancer which are fairly well known. Then it's easier to get money, and they just don't know what this kind of cancer is, and that it is so difficult to deal with. But it's not over rare. I remember that once I knew a lady who got a heart cancer. The heart cancer is fairly rare, very rare. So to get, you know, funding money for this cancer is just terrible. Our cancer is rare, but 1,000 people in Europe disappear each single year because of it.
Yeah.
So, and I think we have to go professionally. People in aiding, helping us in a campaign for that.
Helen, I think with respect to nutrition and stuff, haven't AMMF done something in that area?
Thank you. I mean, you're absolutely spot on with your thoughts, Paolo. The generic information that goes out to help people, nutrition information that goes out to help people with cancer is not always relevant for those with cholangiocarcinoma. If you have had a surgical resection, that means your digestive system is vastly different to what it was previously. You will have had your gallbladder removed, you will have had your, in very layman's terms, your intestines virtually joined to your liver because your bile ducts have been, the main bile duct has been removed and so on. You cannot digest fatty items like you once could have done. And yet, these patients will have lost weight. So the general nutrition will say, eat cream, eat butter, have cheese, build yourself up. That's going to give you enormous digestive problems. We need proper nutritional advice for those with cholangiocarcinoma. Even if you've had radiotherapy or chemotherapy, it can upset your digestive system. You need correct advice. So we have got we've got some advice on our website around the correct sort of diet helpful for cholangio patients, but we do need more. What we would dearly love, and it's very difficult for us to find in the UK, is somebody who is specialised in the nutrition of for cholangio patients. And unfortunately for us, most of these work within the private sector. They're willing to give information to patients, but only if patients can pay for it. And this can be very difficult for patients. But if we could come up with, I mean, these will be the same problems across Europe, won't they? They're not novel to or unique to the UK. We could join on a project like that.
And I think that we also talked during the presentations, but not right now, and this would be a work that we could join forces. It would be about the drug approval with EMA, with European Medical Association, is it, EMA? I don't know if UK also are with the EMA process or not, EMA process, but here it's something that the associations, if we join forces, we could push to get approval faster, because at the end of the day, what we see is that it comes with a lot of delay, and then each country, they have to negotiate the reimbursement. So, and when you get the disease, time is key.
I think we've discussed a number of topics where we could collaborate more effectively than we currently do. And I think that we highlighted that possibly having a group meeting once every 6 months just to share experiences and knowledge would be valuable to each of us. So, in terms of our next steps, if we have that as our goal, that we will have a meeting in 6 months from now, a virtual meeting in 6 months from now. Well, you could all meet, but yeah. But if everybody came to the conference, then we would have to have a side meeting to discuss. But if you could all come to Stansted in May. Yeah. So if you could all come to Stansted in May, then we could have. I don't know if we've got any evenings free. Have we?
We can find time.
Yeah. So. Or one day after. Yeah. So we could, if we program a meeting during the conference, and then we over the next few months we can put together an agenda for that meeting.
If people can't come to our conference in May in London, or maybe some people can, some people can't, but if others want to join us, we can also run the meeting on Zoom, so we can be talking and it can be going out live as well. There's endless possibilities, and if that doesn't work, we can do a virtual one a bit later.
But I think given how stretched we all are, trying to commit to more than just putting together a meeting in 6 months' time might be a bit too much effort for us to do. So we'll take small steps, and we'll work towards greater collaboration as we move forward. But I think this is a good start, and I think one of the other points that you made, that there are many other countries in Europe which have a significant problem with cholangio, so we need to try to identify whether there are other groups that we're not currently aware of that we could bring into this European fold, and help them to benefit from our common experience. So I think that's a bit of homework that we could take away to do. But I think the key thing is to programme a meeting in 6 months, and in the interim to put together an agenda for what the key things to discuss at that meeting might be. And it would also be valuable if we make that meeting known to our individual communities, so that they can contribute and say, well, I think that the European group should be considering this issue, or has anybody thought about this particular thing which I'm worried about, but nobody else in Europe seems to be concerned about. So we could bring all of those things into the meeting. So has anybody got anything to add that they would like to see either addressed at that meeting, or anything else that they think we should be doing before that meeting? So if we set a deadline of a month before, so if we assume that the meeting will be held during the European conference, the AMMF European conference in May, then a deadline of early April for items for the agenda would be a good thing. Yeah.
Sì, no, io voglio solo proprio ringraziare tutti, perché, come diceva Federica, siamo qui tutti spinti dal cuore, no? Siamo spinti dal cuore, siamo tutti spinti dallo stesso obiettivo: aiutare chi incontra questa malattia. Quindi grazie a tutti gli oncologi, i chirurghi e a tutti noi, cioè che personalmente ci mettiamo costantemente in gioco nelle nostre conoscenze, capacità, eccetera, per aiutare gli altri. Solo questo.
Well, if everybody's happy, then I'll just hand the chair back to Paolo, and he can close the meeting.
You know, the meeting has been hit deeply by the Italian general strike yesterday. No trains, no communication, people somehow terrified of reaching Venice. In Venice, as you know, there were no boats.
Yeah.
You know? Anyway, I think the meeting has been rich, and my aim was to try to have something done together. And the plan is to do something together, and to try to share our experiences and to improve our action. And I think this could be possible. I hope it will be real. Thank you, everybody. Thank you, at least I'm sorry for this distinction, especially to Helen, who is, this is sad to say, the senator in this kind of business. Now, she is the most expert, and we know it. Thank you very much to everybody.